Hello and welcome everybody. We're going to wait a few more seconds to let everybody log on and we'll get started soon. All right, so welcome to our third seminar of our third year of the Disability Health Research Seminar Series. We are really honored and lucky to be speaking to Dr. Anjali Forber-Pratt today, who is the director of the National Institute on Disability, Independent Living, and Rehabilitation Research, also known as NIDILRR. And I will read her bio in just a minute. My name is Franz Casper. I am a research associate at the Johns Hopkins Disability Health Research Center, and it is my pleasure to welcome you all here today. I am a Latino man with black hair in my 30s, wearing a blue suit, sitting in an office in Baltimore at Johns Hopkins. My pronouns are he, him, and I am so thrilled for this discussion today and for you all joining us. So I first want to mention that we have card captioning services available. Um, you can see the link in the chat, and we also have ASL interpreters joining us. So thank you to the interpreters and the captioners. Today, we're going to be talking about the inclusion of people with disabilities in research and how research and policy intersect to advance equity for the disability community. Lots of good conversations to come. Next slide, please. So for today, we have some logistics. After a moderated session between Dr. Forber-Pratt and myself, there will be a Q&A session with you all in the audience. We ask that you please place your questions into the Q&A function. Your messages will be sent to the panelists and the moderator, which we will then read out loud on your behalf. I also want to reiterate that we have ASL and CART available. And this session is being recorded for your awareness. If you have any technical difficulties during the course of the session, particularly in access needs, please contact Mindy at epits or at jhmi.edu. Next slide. We would like to begin today with a land acknowledgement. We recognize the enduring presence of more than 7,000 indigenous peoples in Baltimore City, including the Piscataway, Lumbee, and Eastern Band of Cherokee community members. Next slide. So this series is really linked to a course that is being run out of the Johns Hopkins School of Public Health in partnership with the Disability Health Research Center that is directed by Dr. Bonnie Sweener. And we just want to give a quick plug. If you want to learn more about our work, you can do so by going to our website, disabilityhealth.jhu.edu. Check out our podcast included, and we are also on social media. We will be posting about this session as well as the next sessions in this series on those channels. Next slide. And with that, I will introduce our speaker for today, Dr. Forber-Pratt. I am really thrilled and honored to be kicking out this session with this conversation. So Dr. Forber-Pratt is a disability activist, a two-time Paralympian, fellow of the American Psychological Association, and the director of the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDILRR, in the Administration for Community Living. Dr. Forber-Pratt serves as the chair of the Interagency Committee on Disability Research. As a wheelchair user for over 35 years, Dr. Forber-Pratt is nationally and internationally recognized as a disability leader and mentor. It is my honor and privilege to be welcoming Dr. Forber-Pratt to this conversation. I really am thrilled to be having this discussion, and thank you so much for taking time to join us. We are really, really grateful that you're here today. So I'm going to go ahead and jump in with some questions, and just a quick reminder to the audience, if any questions come up as we go along, please type them into the Q&A, and we'll get to those at the end of the session. Dr. Forber-Pratt, I think that a good way to start off this conversation is to begin with you telling us about NIDILRR, or whatever else you want to share about your time there and your role as the director of this institute.
Absolutely. And first of all, just thank you so much to all of the organizers and to Johns Hopkins, and for just how awesome that this series exists. It truly is exciting to be here with you all today. Before I jump in to answer your question, I also just wanted to share a brief visual description. So I am a brown-skinned woman with long black hair that's up in a ponytail and wearing a red shirt with a black blazer. And I have a blue virtual background with ACL's logo behind me, and not seen on screen, I'm sitting in my manual wheelchair, and my black lab service dog, Colton, is nearby. I really am thrilled to get to share a little bit more about the National Institute on Disability, Independent Living, and Rehabilitation Research, which is a mouthful, so NIDILRR. We are the federal government's main applied disability research organization. And so our main purpose is funding extramural research grants that help to generate new knowledge that expands society's capacity to provide full opportunities and accommodations for people with disabilities to participate in all aspects of society. I do want to share and address a common misperception that NIDILRR is not a part of the National Institutes of Health, or NIH. We are, as was said, a part of the Administration for Community Living, whose mission is to support not only people with disabilities, but also older Americans. So at NIDILRR, we fund that research on the long-term outcomes and interventions, identifying barriers and challenges that affect people with disabilities in terms of participation in society. And across other areas of the Administration for Community Living, our counterparts provide grants to states that fund programs and services, such as things like Centers for Independent Living or the University Centers for Excellence on Developmental Disabilities, and also the protection and advocacy organizations that exist in each state, like, Disability Rights Connecticut or Disability Rights California, for example. And at NIDILRR, we, with our small but mighty budget of $119 million, we sponsor three main types of grants. So research and development, capacity building, and knowledge translation. And knowledge translation, this is NIDILRR's way of really ensuring that research findings that are relevant to the communities that we care about actually get into the hands of those individuals, whether that's into the hands of people with disabilities, into the hands of family members and caregivers and so forth, or providers or whomever, because we know that oftentimes research that sits in academic peer-reviewed journals doesn't necessarily get into the hands of the right people who we really want to engage with those research findings and so forth. So I just wanted to share that piece. And I guess I'll also share that I have been in this role as serving as the director of NIDILRR since May of 2021.
Yeah, thank you for your answer and for telling us about the mission of NIDILRR. Certainly, NIDILRR plays a crucial role, and I would say unique role, in that, as opposed to other federal research agencies that focus on prevention and treatment, you truly are at the forefront of efforts to advance research that focuses on increased participation of people with disabilities in their communities. And that is just tremendously impactful. So by looking at NIDILRR's 5-year agenda, this plan emphasizes the inclusion of people with disabilities as critical to advancing both the rigor and relevance of NIDILRR funded work. So you have a clear commitment to improving and expanding the inclusion of disabled people in research. Can you discuss that and any advances in this area that could impact health equity?
Yes, absolutely. So, just by being a brown disabled woman, throughout my entire personal life, I have and continue to face and experience disparities when simply trying to exist or to access education or employment or healthcare or trying to access services, right? And all of these different identities really shapes my lens and sort of the lens that I bring, I feel, to this particular role. And I also think that our identities and positionality are just so important in everything that we do as researchers, as educators, as policymakers, or as human services providers, and truly just as members of society, because those identities shape our lens and our viewpoints, and it shapes what questions that we ask and how we interpret those results. And it's no surprise that academia and research has had a long history of systematic exclusion of certain voices. And that's really at the heart of what you're describing in our long range plan that we're really trying to chip away at. Because people with disabilities experience such disparities, we've been shut out of a lot of these types of opportunities. And I also believe that we need people with disabilities who have experienced those disparities in the scientific workforce, studying these issues and asking those questions. And we also need, people with disabilities in our diverse representation of our study participants and in, the materials that we produce and create and disseminate about those research. And we need all three of those, as the researcher, as the study participant, and as that representation is shown in the work that we do. And it takes that intentionality. And I think that that's the other piece that I'm so proud that NIDILRR has this reflected very strongly in our long range plan of being a strong commitment to grow our capacity building, to invest in researchers and investigators with disabilities, and to help us, have that pipeline, and so that all of this wonderful, important work can continue to be studied in the decades to come.
Yeah, that's a great answer. Thank you so much. A great overview of where we stand in terms of disability inclusion, not only in research, but in terms of representation when it comes to study participants and in the workforce. And a reminder as well that there's still a lot of work to do. A lot of the people tuning in today are mostly in the wheelhouse of public health, and many of them, including our students, are interested in doing disability health research. A research that capitalizes on the social model of disability lens to put forward the message that there are disparities in health and in society that need to be addressed, and that largely relies on publicly available data. And that takes us to our next point. In the light of the recent developments around the proposed changes by the Census Bureau to the questions on disability, when it comes to disability data, how can we convince the larger community of researchers and policymakers that consume this kind of research that decisions on these issues cannot be made without including the perspective and expertise from the disability community?
Yeah, absolutely. So first of all, I think back to sort of the main mantra in the disability community of nothing about us without us, and how important that mantra really is and always has been, but how I feel like it's so important in this example that you provided, like that means in data conversations, in policies that affect people with disabilities, and all of these different layers and pieces, and how important it is to have meaningful engagement with the community as well. And so I feel like, there's been tremendous advocacy, and thanks to many that are on this call and so forth, where we've seen the community really rally behind this and really shed a light on hey, we can't be the afterthought. We need to be thinking of these meaningful engagement pieces upfront, proactively, with intentionality, with care and concern, so that these complicated questions and conversations about how it is that we should be, collecting disability data or changing how we collect disability data, can and should occur. I also believe that is something that NIDILRR, that we do really well, and I'm grateful that many of our federal counterparts are engaged with us, asking how, who are the disability researcher stakeholders, who are the disability, community organizations that are really invested in and that have these important voices to share and so forth related to disability data conversations. Because the other piece that I think is really important to understand, which is layers of bureaucracy and so forth within government, which is part of data discussions that happen across government are often separated to what are called these statistical policy centers, or statistical from the Statistical Policy Council rather, and oftentimes those individuals are not the subject matter experts in the nuances of disability the way that many of the individuals here on this conversation really are. And so that and that's just sort of, an artifact of how these Statistical Policy Council and members and so forth have existed and so forth. And I feel like it's important for us to help to educate our other data scientists and other, individuals about these important nuances related to disability, because oftentimes what I have found in this role, oftentimes it's not that a person is trying to intentionally, exclude anyone or to be malicious in any way, shape, or form, but it's that they haven't ever thought about it, right? And I know that sounds hot, that may sound weird, because for many of us, it's something that we think about every single day. But for many, it's oh gee, like we didn't think to ask a disability related questions, because it just didn't cross their mind.
Well, thank you so much. A fantastic answer to a difficult question. It is important to think who are really the main stakeholders, the community experts. So you brought up a really good example. All of this progress on inclusion of people with disabilities in research cannot happen without cross-agency partnerships and collaborations. So can you tell us a little bit about the Interagency Committee on Disability Research, and about the importance of aligning and coordinating research efforts across federal departments and agencies?
Absolutely. So, okay, so with the Interagency Committee on Disability Research, so this has been around for quite some time, and we have a subcommittee that also focuses specifically on disability statistics. And that subcommittee it existed many years ago, and we actually brought it back in I think it was 2022. And but how that subcommittee and so forth interfaces with these larger efforts across the government, I also want to draw attention to a brand new interagency group that again is digging in deeply on these particular issues. So that is connected to the White House Office on Science, Policy, and Technology. It's a new Disability Data Interagency Working Group, and it is connected to a much larger group that is that's called the Equitable Data Working Group, which they had I can't remember what year they were initially formed. But anyway, they were this Equitable Data Working Group was tasked with all sorts of recommendations around how to make disaggregated data the norm while also protecting privacy, creating and building a stronger federal infrastructure to leverage data, building capacity, and so forth. And they tackled several different high priority areas, which included race, included sexual orientation and gender identity, And then midway through their work in a progress report, they said, hey, and now that we've done that work, we also want to focus on disability. And so that has led to, and this is, as I said, very newly formed group, like a matter of just a few months ago. We've only had a couple of meetings, and this is an internal to government group. But there are going to be several opportunities for public engagement that I think that everyone here should be aware of. So for example, there's going to be, as a result of this disability data interagency working group, one of the things that we will be working to create is a federal evidence agenda on disability data. And so there is going to be a request for information that will be coming out in the probably in the next month or two, I mean, give or take, where we'll be soliciting input and feedback on what we should be talking about. The other piece that this group is also going to be engaged in is listening sessions with the disability community around specifically disability data needs and data challenges and the nuances and the messiness. And so please be on the lookout for that information as it becomes available as well.
Thank you for your answer and for sharing about that recently formed initiative on disability data and all of the exciting developments that are taking place. Not only is it important to coordinate efforts focused on disability, but also making sure that these efforts drive forward research that tells through data the story of those living at the intersection of disability and other minority identities. Since NIDILRR's portfolio and you in your own research have had such an important focus on intersectionality, can you share with the audience why that is important and the implications for health equity efforts?
Certainly. I feel that there's so many unanswered questions, right? When we think about truly in this intersectional space and just, historically Black and brown and otherwise multiply marginalized communities of people with disabilities have either been completely silenced from research or not given the opportunities to participate in research for various reasons, or have experienced, unfortunate historical traumas or feeling like they couldn't participate in research for various reasons. And so from my perspective, I feel like it's so important to make sure that we are also funding really important, work that really digs into this intersectionality. And again, I think that it's not just in the research work that we fund, but it's also in our trainees and sort of thinking about the capacity for the field. And so that's another way that at NIDILRR we really take this to heart. So for example, one of our funding mechanisms, it's our advanced rehabilitation and research training grants, which are postdoctoral grants that are awarded to universities to like have a cadre or like a group of postdocs, right, that are studying a specific area in rehab. Well, we require that applicants describe the racial and ethnic diversity of the target population of people with disabilities, and specifically with that training grant, we ask for how are you going to be recruiting individuals with disabilities as part of your application, and like, so those are two examples where we're really saying to the field, the importance for this intentionality and this intentional reach out, because if we leave it to chance, then we're not really getting into and digging into the heart of these issues, whether it's from the research perspective or in terms of supporting trainees.
That's fantastic. Thank you. No, absolutely. It is important to be, as you said, intentional about collecting this data and directing these efforts with an intersectional lens. Since our
Sorry,
seminar,
if I can
sorry, go
add
ahead.
one more thing that I meant to
Yeah,
say too.
absolutely.
The other piece that I think is really fundamentally important, not just for us at the National Institute on Disability, Independent Living, and Rehabilitation Research, which is what NIDILRR stands for. I saw a question for clarification on that. But it's not just something that we at NIDILRR are doing, but we're encouraging others across the federal government, and I would encourage individuals outside of government too, that if we really want to move that needle, then we also need to be collecting these data ourselves to see how we are doing with that. So for example, as of 2024, we collect optional demographic information that includes disability as well as race and ethnicity and so forth about our peer reviewers. Because if we're saying, hey, we really want to make sure that we have good, diverse, intersectional representation on our peer review panels, and that individuals with disabilities are serving as peer reviewers, well, we needed to actually hold ourselves accountable and collect that data to show that yes, in fact, we are doing that. And you know, I mean, for a long time, we certainly have had. It's not that we've not had peer reviewers with disabilities, you know, involved, but we weren't collecting that information and talking about it. And so so that's the other piece. And again, like that's just one example. We require grantees to share that type of information in their annual reporting and things like that. But I think that it's a really important piece of like, hey, if you want to move the needle, you also need to collect those corresponding data and in order to see and hold yourselves accountable.
No, thank you. I absolutely agree, and it's great to know that you take those intersections into account. And to that point, since our seminar series this year is focused on disability health equity, can you share with our audience what do you think are the biggest challenges in research or policy to achieving that overarching goal of equity in health for the disability community?
Oh my gosh. So yes. So first of all, in a lot of ways, I feel like we've arrived, you know, in some ways, meaning that, you know, disability and disability data and talking about disability and disparities that are experienced by people with disabilities, that is becoming more and more mainstream. I know many involved on this call you know, helped with the advocacy push that ultimately led to the National Institutes of Health designating disability as a health disparity population, for example. But from where I sit in this role, it's hard to disrupt these deeply rooted systematic barriers that exist and from within government. Oftentimes it might take, you know, changing rules, which can actually mean a whole change in legislation or like an act of Congress in order to bring about that change. And so what I mean, I guess, a little more tangibly is that there's a lot more awareness of disability health equity, but there are some who I think sort of latch onto that as a buzzword. And this happens in all areas of research. I mean, you know, we've certainly seen this happen, but I think that we can't, like, to me, that's one of the challenges in terms of where we sit of how do we continue to push the boundaries on research and research policy in meaningful, progressive ways that still continue to chip away at these systematic barriers, and that it can and will take time and energy, and we don't want to lose the wonderful, like I said, the momentum and the awareness. But I also think, especially for those in the public health space or the broader health equity space, we need to be meaningful partners with those who may not have the expertise in disability, and to partner with them, offering up our disability expertise and knowledge, but to capitalize on the sort of the power in numbers to really be able to move the needle in a variety of conversations and in variety of policies and ways and so forth.
Yeah, no, thank you for your answer. I agree that we need structural changes that can help advance equity in health for people with disabilities, and we cannot um, think about the achievement of this goal without accounting for all the social determinants of health that truly drive these disparities. And yeah, this is really helpful for the audience to better understand priorities in disability research. So now let's talk about your own personal research, which has been impactful and widely cited. So it would be great to hear you talk a little bit about the work you have done on disability identity development, because I I do believe that it has some underpinnings to what we have been discussing so far. For example, when it comes to psychological frameworks that explore how individuals perceive themselves and see themselves as agents who can cause and influence events, I reflect on the importance of those frameworks and of identity development uh, in driving equity for people with disabilities in health and in participation in their communities through self-advocacy, community support, informed policymaking. So can you share some key points for our audience about your work on identity development?
Absolutely. So first of all, this is an area that's near and dear to my heart, and I could probably talk for hours on this. So, but you know, when I think about disability identity, this is a sense of self that includes a person's disability, as well as feelings of or connection to or solidarity with the disability community. And having a coherent disability identity helps individuals to adapt to disability, to navigate all of these aspects of structural ableism that we've also been alluding to in this conversation too. And disability helps to shape how individuals see themselves, your bodies, as well as how you interact with the society and the world around you. Um, I do think that for me, one of the really intriguing pieces was that I wanted to be able to better understand the experience of disability and how you develop a disability identity, so that we could then better tailor our interventions and better support people with disabilities. But, you know, I was asking questions like, how do you know when a person's struggling with their disability identity? Is there a difference between being born with a disability versus acquiring it? And is it, you know, is it aged? Is there age differences in terms of, you know, acquiring it in your teen years versus acquiring it later in life? And, you know, I wanted to answer questions like what makes it so that a person has a strong disability identity versus another. These were the many questions that sort of drove my line of research, which I should also say has been completely on hold while serving currently in the federal government. But you know, a lot of my earlier work was, you know, we did systematic literature reviews, we did some small scale qualitative studies, and using that to really come up with a framework of the key components of disability identity, to then be able to develop and validate a measure on disability identity. And because all of those questions that I was sharing that I wanted to have answers to, you can't actually answer those questions until you have a way to measure disability identity. I will also fully admit, I am not a psychometrician by any stretch of the imagination. I had to partner with wonderful psychometricians in order to develop and validate, you know, a measure in that way. And I'll also say that I'm proud to say that measure does exist. It is out there and available in the world for free. And I think that the other, you know, the other really exciting piece that I don't have the answers to, because as I said, while serving in this role, all of this sort of got put on hold. But we're being able to use this incredible data set that we have from that process, to be able to start to ask some questions of sorry, not to ask questions, to find answers of, if you were born with a disability or had an acquired disability, you know, how does that look? And what we found in our preliminary analyses was that if you were born with a disability or had your acquired disability for 10 or more years, you perform the same on our measure of disability identity, which, like, that was really important information to know and to learn. And again, there's many more questions that I can't wait to be able to answer, because I want to explore more about that duration of disability and also the visibility of disability. Like, how might that be affecting, or having more than one disability? I mean, I have so many questions, which again, I'm just really excited to get to dig into, some point down the line.
Well, thank you for the fantastic answer and for sharing about the research. This definitely underscores how, when we think about disability research, it is important to think about it from a life course perspective. And then this is a fantastic conversation, and I know that some of the members of the audience do not necessarily do disability research, or are thinking about like transitioning into disability research. So that really brings like that really creates the need like to discuss like how it is important to infuse a disability lens on top of research on other health outcomes, wage disparities, housing, transportation. So thinking about the work that NIDILRR currently funds, because I can see that some participants are interested in learning about funding opportunities. What do you think are the most pressing issues in research for the disability community in that connection you were describing on how research is linked or needs to be linked to disability through a framework of increased participation in society? Is there sort of a particular focus for disability research that we need to be thinking about?
So I have an interesting way of answering that question, which is, I believe that you all actually know the answer to that question better than we do. And that actually is NIDILRR's pretty strong position on this. So let me explain what I mean by that, which is the majority of the work that we fund at NIDILRR and is reflected in our notices of funding opportunities is what we call field initiated, meaning it is up to you, the applicant, to make the case for what it is that you're intending to study and what gap that it fills and why it is important and relevant to the field. And part of that is because we exist to fund research, as I was sharing, that affects the entire disability population. That's 67 million Americans with disabilities, with a huge variety of types of disabilities, physical disabilities, sensory disabilities, intellectual, cognitive disabilities, communication disabilities across the lifespan. Like, we can't possibly be able to say, oh, this is the, the number one pressing need or area or what have you. And so that's why we've really taken a stance of, hey, it's up to the applicant to really make that case and to make that justification as to what should be studied. So what you see in what you see in NIDILRR's notices of funding opportunity announcement is that we give really broad guardrails. So for example, we might have a broad guardrail of, hey, we're looking for research on improving employment outcomes among people with serious mental illness, for example, or on the health and function of people with physical disability. So in some cases, we're giving a broad domain or a broad topic. In some cases, we might be giving a subset of a disability population, but then it's up to the applicant to really get into the nitty-gritty details of what is the most important or most pressing need, because I feel like you all know better.
Thank you for your answer. So how can participants, how can the audience learn more about NIDILRR and potential funding opportunities?
Yes, absolutely. So there's a couple easy ways that you can learn more. So first of all, acl.gov/NIDILRR. It brings you to the main webpage for NIDILRR itself. And within that page, there's a newly launched NIDILRR toolkit, which provides a really nice overview of all of our funding opportunity, like mechanisms and so forth. And it's all available information that would take you a while to hunt and find throughout. the webpage. So that's what this toolkit really is meant to put it in sort of a one-stop shop and so forth. The other way is going to grants.gov, which is a great way to learn about any federal funding opportunity announcements and so forth. And in the keywords, if you just put in NIDILRR, then you can see opportunities that are either forecasted or posted. And I do want to draw attention in particular to this group of a new opportunity this year, which is currently forecasted. The full notice of funding opportunity announcement will be posted within a couple of weeks, which is a Switzer Research Fellowship for doctoral dissertation research. So for the first time, we have created this mechanism to support doctoral candidates in their dissertation research. So previously, our fellowship mechanisms, you had to be at that postdoctoral level. So I did want to, like I said, draw attention to that one in particular. And the other piece that I will also share, which is across NIDILRR and across the federal government, we post what's called forecasts. So like a short blurb of what's going to be coming in the next fiscal year. And all of those will be posted by August 1st to give you a sense of what will be posted, because like our competition season is currently underway. So some of these grants are, coming up on different deadlines. Some of our deadlines have already passed for this year. But by August 1st of this upcoming year, then you'll have a sense of what's coming for this next year, which can help you with your planning process and knowing what is coming.
Thank you so much. I am keeping an eye on the time, and I realize we have one more question left, as we have seen some questions are coming in through the Q&A. So at this time, I do invite you, if you have any questions for Dr. Forber-Pratt that have not been put in the Q&A yet, please do that now, and we'll be able to get to those very soon. So let's end this discussion on some actions or actionable steps in terms of what can researchers, students, trainees, and community members really do to advance disability health equity from your perspective at an individual level or at a societal level, having that responsibility of being a researcher or a community organizer?
Mm-hmm. So first of all, ask the questions. I mean, even if you aren't yet a disability researcher, if you're in conversations where you're talking more broadly about health equity, raise the question, what might this mean for people with disabilities? Put people on research teams with those lived experiences and support them to be able to succeed and advance in their careers. I mean, I feel like a large part of what to me is actionable. It's helping us to normalize having disability be a part of all of these conversations related to health equity, and that's partially how we hold ourselves accountable. Where if it's so that then it's not always falling to the same old single person to like raise their hand. And I've been that person. I've totally been that person. I'm like, hey, have you thought about disability? But the more that we encourage others to do that, then it becomes a more normal part of the conversation. And then anytime we're talking about, other underrepresented communities, like that we're naming disability, that we're having that be an integral part of the conversation as well.
No, thank you. And I totally agree. You articulated it perfectly. I think for public health professionals in academic spaces, these are critical issues that we need to be trained on and to think about. If the goal of our work is to have positive impact and to make change, it is important to think ways to get outside of our own research silos and undo medicalized views of disability that are still widely used in public health curriculums. So this conversation was a truly great reminder of the need to think of ways to make research more inclusive of people with disabilities. This is such an important call for action for public health research. And like you suggested, now the moment to rise to that occasion and really frame public health research to be inclusive and centered on the disability community. And I loved what you mentioned about the need for people to start thinking about disability, particularly people or researchers that haven't thought about these things before. So thank you so much for this great discussion, Dr. Forber-Pratt. I am truly grateful for the opportunity to have this conversation with you, and I am grateful for your leadership and all of the work you do for the disability community at NIDILRR. So with that, I want to open it up to our audience Q&A session in the last 15 minutes or so. We've got a lot of great questions, and I will go in the order that they have been posted. So to start out, there is a question on how this is a question about like disability through more of like an international lens. How can people with disabilities from the global south, where the majority of disabilities are found, can make sure that their voices are not disproportionately swallowed up in the research space, that they can have more representation?
Yeah, and I think that it's not dissimilar to how I was talking about the importance of intersectional research. I mean, like to me, disability in the global south is a really great example of sort of a subpopulation, a sub-community where we need direct intentionality and direct, conversations and engagements. One of the wonderful things that I've seen happen across NIDILRR grantees is, and like what I think is a really great what's the word? I guess silver lining from the COVID-19 pandemic is that more and more virtual convenings like are here to stay and so forth. So some NIDILRR grantees have pulled together international forums to really be able to showcase, what is happening from researchers, for example, in the global south in specific areas like home and community-based services, right? Or what's happening related to, intellectual disability in international communities and so forth. And being able to showcase and have that sort of community of practice and knowledge sharing and so forth in a way that then I also hope fosters collaborations and future work. And so I hope that those types of intentional community building is, I think, what I would say is the most important piece to me related to that.
Thanks so much. I really do appreciate that perspective of bringing that intentionality into collaborations that can advance evidence for people with disabilities at an international level.
And sorry, I should also say that in NIDILRR's long range plan, we have said that we want more international presence and international research, and so that is something that NIDILRR leadership really does feel very strongly about. Sorry.
Thank you. No worries. Thank you so much. So there is a comment about the need to include mental health disabilities within the umbrella of disabilities. So the participant mentions that they are shocked by the lack of data on mental health of individuals with disabilities and the lack of data on mental health overall within the umbrella of disability and the availability and coverage for mental health care. The participant also says, I also have not seen data that looks at mental health diagnosis as a primary disability. Is it a topic that many mentees and clients here disclosing at their universities, grants, and employees? And maybe we can sort of like add to this question, what is NIDILRR's vision like in terms of including people with mental health disabilities within your funding opportunities and within your school?
Absolutely. So at NIDILRR, mental health equals disability. Like that counts as disability, and from our perspective, and is strongly represented in and across our portfolio. So in this was, I don't think that I've updated this analysis since 2022. So some of these numbers are, I know would be higher, but in 2022, 30 of our currently active grants at that time had a sole focus on mental health and mental health as disability, and that has, and I have to give credit where credit is due to many of my past predecessors that who really, to the point of the person asking the question, for a really long time mental health was treated as something separate, or something that, you know, and all of that, and it was really our predecessors who were like, no, absolutely. I mean, when you look at the Americans with Disabilities Act definition of disability, like, of course that you know falls in alignment. And so for nearly 30 years, NIDILRR has really said, no, this must be an integral part of our work. I should also say that one of our large Rehabilitation and Research Training Center grants is actually co-funded with SAMHSA. So SAMHSA is the what is it? It's the Substance Abuse and Mental Health Services Administration within Health and Human Services. And that's just one example where, and we previously, and again, many years ago, had several co-funded grants with SAMHSA. But this was something that we were able recently, just this last year, we're able to reestablish that partnership and that that very important collaboration. And what that also allows for is that my staff, as well as with the SAMHSA staff, we're engaged in these conversations together and sharing resources. We actually communicate monthly. We have a standing monthly meeting, which I think is so fundamentally important. It goes back to an earlier question around that, the importance of that interagency coordination and collaboration as well.
Absolutely. Thank you. And I appreciate you putting forward that message to the audience. So moving on, our next question asks whether there is any momentum or any intention to develop and administer a disability-focused population survey, perhaps in coordination with census and ACL or HHS.
So I don't know the answer to that question. And because I think in part that with kind of where things are at right now with the census. So if those on the call are not aware, the proposed changes that were described have been put on hold for now. And some of these types of things, it's like figuring out whose lane is what. And so in terms of any type of, you know, joint cross effort of an actual survey, I think that really would have to be, there would have to be more indication of that type of thing coming from, you know, from census themselves or things like that. So I don't have a great answer to that particular question.
Okay, yeah, thank you for your answer. Yeah, it's absolutely a difficult question to answer. So moving on, there is a participant that asks, what would your advice be for disabled students within research and academia specifically?
Oh, I love this question. So first of all, I would say, my goodness. So first of all, I would say find yourself a variety of different types of mentors. I mean, I feel like each mentor that I had going through my schooling and so forth, each one sort of brought a different and unique perspective. I also found that oftentimes, and it was disabled students that found me in my research lab and found each other in terms of building that sense of community. And so that's why I think it's important to have a variety of mentors so that you can build and create that community really, for yourself. And I think the flip side to that is don't be discouraged if you're feeling really isolated at your university or within your department or your program, like try to expand your mind a little bit to where else, even outside of your department or university, where you could find that mentoring and find that support, because it's out there. I mean, the Disability Health Equity Research Network is one of those areas. I mean, there's a wonderful resource for disabled psychologists. I mean, like there's many more of these sort of sub communities and supports that do exist and that are doing really wonderful things to build that community, because I know academia and so forth can feel isolating. The last piece of advice that I would say is that when comfortable, when able, when, you know, in the places where it makes sense, like, let's not be afraid to share that disabled identity that you might have in, you know, the work that you're doing. And so, you know, in qualitative work, that's often a positionality statement. And I think that what that does, you know, it signals, you know, the importance of having that disability representation, but it also makes that clearer for other folks who may be the consumers of your work, being like, oh, like there was a perspective of disability on this team. And don't be afraid to say, hey, I'm a non-disabled ally, or, you know, I mean, it signals the importance of, hey, you know, that people are on research teams for different reasons. And, like, you know, you might bring a different layer of expertise or a different lived experience that strengthens the work. But by being more transparent about that, it helps all of these conversations.
No, thank you. That's great advice. Looking at the time, we probably have time for one more question. And I think this one is related to the topic of, well, I know you mentioned how NIDILRR's work also focuses on local health departments and the states specifically. So one of the participants asks if you could elaborate more on what these efforts are about in terms of targeting public healthcare institutions or local health departments. And the participant also wants to know about not only about efforts, but specific grants or like funding opportunities.
Yeah, so, you know, it's interesting. So if the health department or public healthcare institution is conducting research, then certainly would be eligible and so forth for applying for NIDILRR grants. But I would say that the other way that I think that healthcare organizations or health departments and so forth could also potentially be involved is so we have this this annual offering now. It's this NIDILRR matchmaking series, and it's sort of like, think Shark Tank, where either researchers or organizations or individuals or and health departments, like, you can sign up to make a pitch, like an elevator pitch of like, gee, I wish we had data on this, or I wish we had answers on this, or I'm researching this and want to be connected with researchers, or I'm researching this and want to be connected with organizations. And these sessions have become wildly popular. And it is, as I said, is an annual offering now that NIDILRR is doing. And the hope is that then it facilitates greater collaboration and so forth that might turn into, you know, grant proposals and so forth that might come come through our normal mechanisms. So I can share, let me see if I have it handy. The best way to find out more about those particular sessions is an email address, which is NIDILRR, NIDILRR -mailbox @acl.hhs.gov. And by sending a message saying that you're interested in getting on the list for when these matchmaking sessions occur, you know, that would get you plugged in. And again, we can share this with the organizers of the seminar so that maybe that can be sent out to the folks who participated today.
Oh, that's fantastic. Thank you for sharing this resource with the audience. So With that, I thank everyone for joining us today, and really thanks Dr. Forber-Pratt for your time and your knowledge and all the work you have done, and for sharing with all of us today. So thank you all for being with us today. Thanks to the team behind the scenes running this, and to our captioners and interpreters. We have another session coming up with Dr. Scott Landis on the 25th, same time, same place, 3:30 to 4:30. We're going to talk about disability as a demographic. So tune in for that discussion. Thank you, Dr. Forber-Pratt, and thanks everyone. Take care and goodbye.